Good morning, everyone, and welcome to the PPV Forum. I'm really sorry I can't be with you today, but I'm leaving you in the very capable hands of David Fitzgerald, our Director of Policy and Strategy in the National Cancer Team. I know many of you have met David many times before, and wonderful to have so many people joining today, in person and remotely as well. So just a few words from me before I hand over to David. First of all, can I just give you all a big thank you, and particularly to people whose tenure is about to come to an end. You've had a fantastic involvement across the National Cancer Programme for 4 years. It's really been invaluable for us to listen to the people who understand what it's like on the ground going through a cancer journey. And you are connecting us up between the national team, our local alliances and local clinical teams. So thank you so much for that. It isn't quite goodbye though, because I think Rachel is going to try and find a way to retain your expertise and involvement in the programme if you're able to stay connected with us. And we want to really think about how we celebrate your achievements later on in the year. But please keep going with the great work. I mean, we really are making progress, and I'll just give you a few examples of what's happening with your help and support. But your contribution is fantastic. Thank you so much. So first of all, I thought I'd just give a big shout out and a thank you to David McLachlan. David McClenachan. I hope I've pronounced that correctly, David, for his involvement with our Busting Cancer campaign. It was a really fantastic campaign, and David's interview alongside Dr. Dawn Harper was the lead piece of content for the project and helped raise awareness of the signs and symptoms of cancer, and encouraging people to visit their GPs. I know the interview appeared with no fewer than 232 pieces of media coverage, including the Daily Mail, ITV, and across regional titles. So huge thank you, David. I won't mess up your surname again, and my apologies. Additionally, big thank you to Katie and Simeon for their input during the February's Fast Diagnosis event in Birmingham, sharing your lived experience with the attendees and bringing to life the importance of the work we're doing. Thank you both for your input. I'm really grateful you both took part. It just makes it so much more important and real for people. Many more projects to mention, from liver surveillance, psychosocial support, and your help with the people and communities engagement evaluation with Rachel. So thank you. And also the work we're doing on innovation. I mean, cancer is a subject where we can really transform survival by rolling out innovation that will have an impact on quality and survival. And thank you to everyone for your involvement in feedback. When we're trying to get new innovative practices into routine clinical practice, it's really important to have your feedback on what this means for people at the sharp end of cancer delivery, and what will really make a difference to people. So thank you very much for helping with that. So I promised to talk about some of the progress that's been made with your help and support, and just a little bit on operational performance, and then going on to faster diagnosis and earlier diagnosis of cancer, which we all know is crucial for improving survival. So on operational performance, we've been through the pandemic. We've obviously experienced industrial action in recent weeks and months. It is a pretty challenging time for the NHS and for frontline teams. But I do want to say that we've made incredible progress over the last 6 months in reducing the backlog of people waiting over 62 days for their first treatment. And the way we've done that is to implement new tiering measures. What that really means is additional scrutiny where trusts or individual services and trusts are outliers in performance, so we can try and share best practice and improve performance across the country through the whole of our cancer community, and making the delivery of care for people with suspected cancer an absolute priority. And the 62-day backlog, which peaked at around 34,000 last summer, was down to just over 19,000 in March. That sounds like a lot, but it's a big drop. And obviously we will sustain that performance to make sure that patients get their diagnosis and treatment as quickly as possible. The other thing that I think many of you know is that we're seeing record numbers of referrals. We're diagnosing and treating more people than ever before. And making progress towards our long-term goals to improve performance against all the waiting time standards. And the sort of brilliant recent news is that we met the faster diagnosis standard for the first time in February, and that ensures that at least 75% of people on an urgent cancer referral are either diagnosed or have cancer excluded within 28 days. So we want to make sure we achieve this consistently, and then we further improve the target, if you like, so that we continue to make sure we're seeing people early and fast. In April, just in terms of trying to make sure we do better on faster, earlier diagnosis, I wrote to all the chief executives of the relatively new integrated care systems, setting out 5 steps. So this is new, but 5 new steps we're asking them to take to increase the extent to which people with suspected cancer are prioritised for all the new diagnostic capacity that's coming online. And we've got a particular focus on the ICBs whose performance was below 70% in February, to give us a plan showing how they're going to use the additional funded diagnostic capacity to achieve improvements for patients, particularly on the most challenged cancer pathways, with a 10-day turnaround benchmark for diagnostic tests. And we're also working with the diagnostic team to make sure that the new community diagnostic centres have the capability and sufficiently trained and dedicated staff to do teledermatology, which can massively speed up the pathway for a patient and allow the clinical teams to be doubly efficient in delivering care. We've asked them to prioritise MR capacity for people with suspected prostate cancer, just to make sure, again, people have a fast diagnosis onwards transition to biopsy or exclusion of cancer, and to maximise gastroenterologist availability, because we know endoscopy capacity has been a big challenge as we come out of the pandemic. And we've seen that people have already reduced their waiting times on this particular pathway, so the lower GI pathway, with a 22% reduction in waiting times. And then finally, we're asking each of the trusts to commit to improving their performance against a 10-day report turnaround time benchmark for histopathology by March 24. So this is just making sure that patients aren't sitting waiting for a result, and that we get uniform practice and speedy practice across the country. So the planning guidance that NHS England has sent out for the year reaffirms the importance of achieving the faster diagnosis standard by March 2024. So we met it this February. We were close to it in March, just below the 75%, but we need to get to consistent performance for patients across the country by March 24. And then, really excitingly, on diagnosing a higher proportion of cancers earlier than ever before, for the first time, we've seen some really positive news in the rapid registration data set. It shows we're diagnosing more patients with cancer at an early stage than before. It's a small shift upwards. So we were at 56%, we're up to 58% of people being diagnosed at stage 1 or 2. That's across 2022, but that's been stubbornly flat for a long time. So that small shift is beginning to show the results of the work that we're all doing together to encourage patients to come forward and to make it easy for people to get a diagnosis or exclusion of cancer. And that shift has occurred with record numbers of people coming forward for urgent cancer checks. So really exciting, because that really is about saving more lives. And just ending with an example of where we've seen, again, really positive movement in the early diagnosis rates, and that's our work on lung cancer. High volume cancer was being diagnosed very late, when it's very difficult to cure people. And it used to be that people who were the least well off were most likely to have lung cancer at an advanced stage when it was identified and diagnosed. But by taking the CT scans to people in that group and diagnosing cancer earlier than before through the targeted lung health check programme, we've turned that trend on its head. So we can now say that people who are the least well off are more likely to have their lung cancer identified at an earlier stage than anybody else. A lot still to do, but real progress being made. And just a big thank you from me to all of you. Your support and advice is really integral to the success of our programme in